What the United States of America really did was to say for the first time that in our country, the richest country in the world, that health care is a right and not a privilege.
Representative Jan Schakowsky helped to get the Patient Protection and Affordable Care Act passed in March of 2010. Now that the Supreme Court has agreed to hear challenges to the constitutionality of the law, health advocates at Families USA's Health Action 2012 conference called for increased support.
You have the organizing and the advocacy and the policy experience. You have the credibility to explain that Medicare administrative and growth rates are actually lower than private insurance.
Attendees heard Representative Donna Edwards describe how several states have already seen savings from a law that holds insurance companies accountable.
Millions of dollars have been saved. Millions of dollars have been returned to consumers because of a tiny little provision in the big Affordable Care Act. And so, you know what? I don't really care if anybody tells us that it was really big. It should have been big because the problem was really big.
Workshops focused on the basics of healthcare reform and improving access in underserved communities full of hardworking families. But the overall theme heard time and time again throughout this conference was a call to action to preserve a way of life and the fact that a healthy workforce is a productive workforce.
What are the opportunity costs for our families when a mom has to choose between whether kids have a roof over their head, food on the table, or health care? People who are sick can't work. Mom or dad can't provide for his or her family if their dollars are going to rising health care costs, let alone keep paying the mortgage if all of a sudden they're wiped out by some unanticipated hospital bills.
Are you going to be the ones to take away health insurance for all those up to 26-year-olds who are out there like my son, who potentially would go without health care were it not for the fact that we now allow them to be able to stay on their parents' health care plans?
A Gallup poll found young adults make up the only major demographic group to see increased coverage. More than 17% of American adults lacked health insurance in 2011, up from 16% the year before, showing the growing need for affordable care.
You are the truth tellers and the organizers, the respected policy experts, and the rabble-rousers.
Rabble-rousers who advocates say could make or break the future of American health care in the next presidential election. For the Machinist News Network, I'm Tanya Hutchins.